Hi, everyone. Thank you so much for joining. This is Brina Kiernan here from the Institute for Reproductive Health at Georgetown University. I'm here today with Callie Simon and Jen Gales from Save the Children, as well as Rebecca Lundgren, Allison Foster, and Sammy Hill from the Institute for Reproductive Health as well. We're going to jump into the agenda just to save time. So to begin, we're going to go over the history and background of the VYA task team. Then we'll discuss the proposed goals of the team, do some member introductions, review what activities we've done this year and what activities we would like to do moving forward, including future webinars, discussing the VYA task team directory, and if we have time, have a conversation about engaging youth directly on the task team. And finally, we will end with any other business and news from all of you. So with that, I'm going to hand the mic over to Rebecca to discuss the history and background of the team.
Good morning or evening, everyone. Really happy to have all of us together today. So I'm going to start going over a little bit of how we got to where we are today. So as you are all aware, I'm sure, interest in meeting the needs of very young adolescents and laying the ground for their future health and well-being has been expanding exponentially over the last 10 years, or maybe 15 years even. I was trying to think, one of the landmark benchmarks for us was the publication of Investing Where It Counts by the Population Council. It was recently revised a few years ago, so I'm not sure the date of the original publication, but that was one of kind of the signs that interest in that field was growing. My organization, which is the Institute for Reproductive Health, became involved around a little bit after that with the development of a publication called My Changing Body, together with Family Health International. Then we followed that with some work on GREAT, Cycle Smart, and some other VYA projects. And at that time, we found, together with our partners in all of those initiatives, there was really a lack of awareness of the potential of programs for that age group. The knowledge was very siloed. There was a lot going on in the field, but it wasn't well known, across levels and at headquarters. So we identified the need for cross-sector advocacy, knowledge sharing, and evidence building to establish good practices for programming, monitoring, and evaluation for that age group. So in 2010, IRH joined with the partners that you see here on the screen to establish the Very Young Adolescent Alliance to try to advance that agenda. From 2011 to 2016, together we, with other partners as well, conducted a number of technical meetings and consultations on very young adolescents. You can see we had a series at every International Conference on Family Planning for the last few years. We also had country consultations in Guatemala, Rwanda, Nigeria, and Uganda. And we had a series of webinars as well with some of you who are on the call and others who are in this room. So in 2013, Save the Children really took the lead for the Alliance to establish the Sexual and Reproductive Health Resource Library, which I think you've seen and we'll talk about a little bit further during the call. And then in 2015, USAID funded a consortium for the Passages Project. So led by IRH, it consists of Save the Children, the Global Early Adolescent Study at Johns Hopkins University, PSI, and Tear Fund. So that project focuses on 3 formative life stages: early adolescence, newly married, and new parents. So that allowed us to, it was sort of a natural fit. We were able to take on the role as a Passages Project of the Secretariat of the Very Young Adolescent and begin a more systematic process to reach out broadly to the community and invite all of you and start really doing a consolidated work plan, which is what brings us here today. So I will pass on the mic to our proposed goals. I think Renan was going to present.
Sure. So for the proposed goals of the VYA task team, these are still very much up for discussion, but we'd like to share what we have now. So the first goal being raise awareness of the importance of investing in VYAs and identify emerging best practices. Second goal of make program practices, tools, and guidelines widely accessible. And the third, provide opportunities for practitioners, policymakers, and researchers to reflect, document, and share learnings to support effective programs. So we'd love to discuss these more during our what activities we'd like to do and how they relate to these goals later on in this webinar. With that, I think we can move forward. Great. So moving on, we thought it would be nice with this kind of newly formed Global VYA task team and this webinar to have you all introduce yourselves to each other, to know who else is on the call and also to know who else is participating on this task team. We realized on a call with 33 or so people that this can be logistically challenging. So to facilitate this, we're going to go in alphabetical order by last name and call people out to introduce themselves. Keep it short and sweet. Your name, your organization, affiliation, and then 1 to 2 sentences on your work with VYAs. There were a number of people who have registered but are not on the call, and then people who have not registered who are on the call. So we may, if we call it a name and this person's not here, we're just going to move on to the next person. And then people who did not register, we're going to leave you till the end, at which point you can unmute yourselves and introduce yourself. So to begin, and I apologize in advance for not pronouncing names correctly, I will try my best. We're going to begin with Dr. Uzodinma Adiryeje. I don't believe they're on the call. Yeah. And so moving on, Gada Al-Attar, also not on the call. Chris Antarine. Okay. And we're going to also say where they're from if they're not on the call, just to get a feel. So from the Real Agency for Community Development. Karen Austrian from the Pop Council. Oh, great.
Hi.
We're going to
Can you hear me? Hi, I'm Karen Austrian. I'm with the Population Council based in Nairobi, Kenya. And when did you say? So I am the principal investigator for a number of studies that are impact evaluations of multi-sectoral programs for adolescent girls, and several of those focus solely on very young adolescents. One example, the Adolescent Girls Initiative, sort of a cohort of 11 to 14-year-olds. That's my 2 sentences.
Great, thank you so much. Next, we're going to move on to Sophie Baumgartner of the International Planned Parenthood Federation.
Hello.
And you are on.
So I'm Sophie Baumgartner with IPPF. I'm based in London. I'm a program advisor for a project called Get Up, Speak Out, which is implemented by a consortium of Dutch organizations. And the whole project focuses on young people, especially very young adolescents.
Thank you, Sophie. Moving on, we're going to go to Jennifer Brema from the Intensive Rescue Foundation International. I don't think they're on the call.
Nicole.
Okay, so moving on, we're going to go to Nicole Cheatham from Advocates for Youth.
Oops, there we go. Hi. This is Nicole Cheatham with Advocates for Youth. I oversee the International Youth Health and Rights Division, and in terms of our work with very young adolescents, it's really in the context of sexuality education, as well as the Amaze project, which is an initiative that uses short animated videos to provide sexuality education to very young adolescents. And thank you so much. We're so excited to join the team. We haven't been on until now, so it's really a great pleasure to be here. Thanks.
We're happy to have you, Nicole. Thank you. So I don't think Helen Corman from John Snow is here. So we're going to move on to Lorette Kukuza.
I'm actually.
Oh, sorry.
Yeah,
Actually,
no, I'm actually
here. So good. Sorry about that.
Yeah, no. So JSI does a lot of work with adolescents, but I'll just talk about the one project that I'm working on in Kenya, where we're working with young adolescents who are at risk of HIV, and we're doing a study right now looking at pregnant adolescents and young girls who 10 to 14 and who are either pregnant or at risk of pregnancy. and developing a curriculum around HIV and pregnancy.
Thank you, Helen, and sorry about that. Now we're going to move on to Lorette Kukuza.
Hi, thanks for having this. I am not affiliated at this point with any international organizations. I'm doing some domestic work for University of Michigan, but as a founding member of the VYA Alliance, I am very attached to keeping up with what's going on with very young adolescents.
Thanks, Lorette. We're happy to have you. Now moving on to Nana Dagadu from IRH.
Hi, everyone. Nana Apnem Dagadu, and I work for the Institute for Reproductive Health. In short, working with both implementers and researchers along with local stakeholders to design, test, and then scale interventions that transform social norms related to adolescent sexual and reproductive health and gender-based violence. A couple of projects, I guess, previously on the GREAT project and currently on the Passages project.
Thanks, Nana. Moving on to Sarah DeMeyer from International Center for Reproductive Health, Ghent University.
Yes, hello, my name is Sarah. So I work for the International Center for Reproductive Health in Ghent, Belgium. And we are the Belgian partner for the Global Early Adolescent Study, a study which most of you know, I suppose. It's a study coordinated by WHO and Johns Hopkins Bloomberg School of Public Health, which tries to investigate the link between gender norms and adolescent sexual health trajectories. Thank you.
Thank you, Sarah. Now we're going to move on to Jose Mateo de la Cruz from Filipinas. Jose, if you're there, please unmute yourself. Okay, we're going to move on to Kara Doran from MSH.
Hi, everyone. This is Kara Endyke-Dorn, and I'm a Principal Technical Advisor with Management Sciences for Health, or MSH. So first of all, I just want to say thank you so much for organizing this call. It's very nice to hear all the very exciting work that people are doing around the world and domestically. So it's great to bring people together and talk about this very important population. MSH has a number of youth programs globally, and so I support the adolescent strategy basically for the organization.
Thank you, Kara. Now we're going to move on to Nina Ford from Promundo.
Hi, everyone. This is Nina Ford from Promundo. I'm based in Washington, D.C. Promundo has been working with youth and adolescents for about 2 decades, but we have a current partnership in Malawi that's given us the opportunity to work with very young adolescents around challenging harmful gender norms, addressing sexual and reproductive health, and promoting healthy communication. And we're hoping to continue this partnership through next year and to develop a component focused on working with parents of youth in this age group.
Great, thank you, Nina. We're going to skip over ourselves and save us for the end. So I'm skipping over Jen. Moving on to Kate Gillis from PRB.
Can you hear me okay?
Yes.
Hi, this is Kate. I'm with Population Reference Bureau, and a lot of our work with very young adolescents comes up throughout our work on communicating with policymakers about the importance of population policy and voluntary access to family planning and other health services. One of our current activities is under the Gates project. We developed a scorecard for youth access to family planning, and this includes aspects of comprehensive sexuality education, access to health care that touch on VYA's rights there. And in addition to doing the scorecard, we're about to do an assessment in conjunction with that. So not just looking at the policies that are on the books, but what's on the ground.
Thank you, Kate. Moving on to Caitlin Gillespie of Japago. Okay. Don't think they're there, so we're going to go ahead to Nicole Gray, Packard Foundation. Okay. Also not there. Megan Greeley from Japaigo. Okay. Ellen Hagerman from Hevos. Okay. Laura Hurley from IPPF.
Hello, hi, sorry, this is Laura. So I also work for IPPF based at the central office in London, and I'm the technical advisor on youth services, and that really means providing technical assistance to our member associations on youth access to SRH services, and also a big part of the work is on CSE. So I'd say that's where a lot of the work with VYAs is happening.
Thank you, Laura. Moving on to Susan Egris of IRH. Not on. Aparna Jain of the Population Council. Anna Kagistin of the Karolinska Institute.
Hi everyone, my name is Anna Kogistin and I'm working as a postdoc at the Karolinska Institute focusing on global and sexual health. I know many of you from my previous role at Johns Hopkins School of Public Health. I used to be the study coordinator of the Global Early Adolescence Study that Sarah introduced briefly. And I also ended up doing my dissertation within that, looking at early adolescent sexual experiences and gender norms. I've also done a lot of consultancies in gender norms and SRH among young adolescents for WHO and Guttmacher Institute, and also a little bit for IRH. So I'm very happy to meet you all.
We're happy to have you. Thank you, Anna. Moving on to Jill Keesbury of Management Sciences for Health.
Hi, this is Jill Keesbury from MSH. I'm very glad to be here and great to hear that so many of our great colleagues are on this call. I oversee the MSH's technical strategy team, which provides technical support to our projects. As you probably know about MSH, we're a large implementing organization, and in our projects, we address adolescent health as part of integrated health projects. And right now, we're really thinking very systematically about how we can engage very young adolescents in our program and how we can ensure that we're meeting the needs of VYAs through our program interventions. So we are doing this in a number of countries, but most the activity that's furthest along is in Malawi, where we have the USAID's flagship health program, HONSE, and we are working with very young adolescents as within communities as part of norms change and information sharing activities. And some of my colleagues are on this call that are really involved with this, so they can talk about that too.
Thank you. I just realized that I skipped Jane Cato-Wallace from Promundo, so if you're on the line, please unmute yourself. Okay. Okay, moving on to Joan Kraft from USAID.
Hi, this is Joan Kraft. I'm a gender advisor in the Office of Population and Reproductive Health at USAID, and I provide support to a number of projects that address the needs of youth, including the Messages Project, as well as some service delivery projects.
Thank you so much, Joan. Moving on to Margaret Kunkenyani from MSH. Okay. Moving on to Sung Lee from Save the Children.
Hi, everyone.
Okay.
Hello?
Yep, we can hear you.
Hi, I'm the Director for School Health and Nutrition, and very young adolescent is an age group that is more and more in school, so it's an important piece of the work we do.
Thank you so much. Moving on to Jean Long from Save the Children.
Hi, everyone. I work with Sung Lee, who was just introduced. I provide technical assistance on school health programs, and obviously VYA, very young adolescents are in schools. I work a lot. I started working a lot in menstrual hygiene management, which is kind of a cross section with CSE and water sanitation and hygiene, and supporting a lot of countries that are really interested in getting more into this area.
Thank you, Jean. Moving on to Clarissa Lord Brundage from the Bill and Melinda Gates Foundation. Okay, I think she joined for the first few minutes. And then Marjorie Marciera.
Hello, everybody. This is Marjorie. So glad to see such an ample, wide group. I'm an independent consultant. I'm based in Washington, D.C., and my work has been with young people, very young adolescents directly, and community-based initiatives for youth development, youth empowerment, and also at the programmatic level, I've worked with Save the Children, for instance, with their gender transformative curriculum development. I've done some publication work with IRH, and currently I'm from Brazil, so I'm trying to get the Global Early Adolescent Study to Brazil. We're doing some advocacy and fundraising work to get the instruments adapted for use there.
Great, thank you, Marjorie. Moving on to Eric Mafuta of the Kinshasa School of Public Health. Okay, I don't think he's on. And then Boladale Mapei from Obafemi Awolowo University. Okay. Moving on to Mather Madwadzeki from Africade. Okay. Piero and Bella from Save the Children International. Okay. Kate McCarthy from the Population Council.
Hi, everyone. I'm Kate with the Population Council. I'm in the Poverty Gender Youth Program, and I'm based in the New York office. My work as relates to VYAs is related to synthesizing information and conducting analysis to young adolescents, either from council programs or from broader literature. I'm one of the co-authors of the Council's Investing When It Counts report that was released in 2016. Thanks.
Thanks, Kate. Moving on to Charlotte Mitchell of Health Partners International.
Hello, everyone. I'm Charlotte Mitchell. I'm a health specialist with Health Partners International, and we're a DAI global health company. We run a wide range of health system strengthening and community engagement programs that include engagement with very young adolescents. A recent program that's just completed involved engagement with adolescents through peer-to-peer support groups. And we're currently running a program in Nigeria that's aiming to empower girls to train as health workers. Thank you.
Thank you, Charlotte. Moving on to Bunbita Mohammed of the Muslim Family Counseling Services. Okay. Gwendolyn Morgan of MSH.
Can you hear me? Hi,
yes, we can.
This is Gwen. Hi, this is Gwen Morgan, and I currently serve as the Deputy Director of the Evidence to Action Program with Pathfinder. But I serve as an MSH. I work with MSH, and I've been doing research on and off with youth since the mid-90s. And I developed and implemented a program, life skills program in Kenya in the mid-2000s with very young adolescents. Currently with E2A, I work on research. I support research on first-time parents and youth-friendly family planning and reproductive health services. And with MSH, I also support our on-site program in Malawi on family planning and adolescent youth-friendly services. Thanks.
Thanks, Gwen. Moving on to Lightwell Mpofu from the Africa Community Publishing Development Trust.
Can you hear me?
Yes, we can.
Hello, everyone. It's a pleasure to be here. I'm from the Africa Community Publishing and Development Trust in Zimbabwe, and I am a consultant, a researcher, and a facilitator, and most of the work that we've done is around sexual SRH, gender norms, and also sexual violence research. We do research on topical issues that affect young adolescents and we've published a lot of books that we then use for civic education and for educating adolescents on their rights. I think that's pretty much it.
Thank you, Lightwell. Moving on to Martha Murdoch of MSH.
Hi, thanks for pulling this together. I'm Martha Murdoch. I'm a technical strategy lead with the FCI program of MSH based in New York. And my current work with VWAs is working on policy advocacy around the elimination of harmful practices, including around elimination of FGM in Francophone West Africa. So I'm really happy to be a member of this exciting group.
Thanks, Martha. We're happy to have you. Moving on to Morris Chris Angam of the Global Forum for Development, Gloford, Uganda. Okay. Moving on to Jane Ote of Japaigo. Okay. Sorry everyone about that.
Everybody.
I think you can hear us now. So we're gonna move on to Mandira Paul of UNFPA. Wow, sorry. Okay, moving on to Erin Portillo of Johns Hopkins Center for Communications Programs. Okay, Laura Reichenbach of the Population Council.
Yes, hi everyone. Can you hear me okay?
Yes, we can.
Thank you. Hi, my name is Laura Reichenbach. I work in the Population Council office in Washington, D.C. I'm the project director of a newly awarded USAID flagship social behavior change research project called Breakthrough Research. We're just a couple of months old, and our partners on that project include PRB, IRH, Tulane, Avenir Health, and Ideas 42. And we very much expect to be working on issues related to adolescence and hopefully very young adolescents. I also wanted to talk about work that the Pop Council and I've been involved in on the Evidence Project in Burkina Faso in Ouagadougou, where we're just now completing a qualitative study of 12 to 19-year-old boys and girls, and we're examining social norms in sexual and reproductive health. And we're looking at it from the perspective of slum and non-slum, in-school and out-of-school youth, as well as married and unmarried boys and girls. Thank you.
Thank you so much. Moving on to Juliana Rios of Pro Familia. Okay. Ishani Ruwanpura of UNFPA.
Hi, my name is Ishani Ruwanpura. I work for UNFPA Bangladesh as a program specialist for adolescents and youth. We work on providing skills education for very young adolescents in 4 areas of Bangladesh with a focus on sexual and reproductive health and gender-based violence. Thank you.
Thank you. Moving on to Jean Sack of Japaigo. Okay. Jennifer Schlecht of Women's Refugee Commission. Okay, Marnie Summer of Mailman School of Public Health. Anna Suleiman of UC Berkeley Center on the Development of Adolescents. Yeah. Linda Sussman of USAID. Rebecca Weir of Plant. Oh, go ahead, Linda.
I don't think it was Linda.
Oh,
sorry. Can I jump in?
Or whoever it was.
I guess I couldn't unmute. Sorry, it's Jennifer Schlecht with the Women's Refugee Commission.
Oh, sorry about that. Okay.
Apologies.
Go ahead.
People back. Yeah, so this is Jennifer with the Women's Refugee Commission. We're a research and advocacy organization based in New York, and obviously focused more on humanitarian context and the needs of women and girls. So we've been doing research on the needs and risks of very young adolescents in Ethiopia. So among 3 displaced populations, populations from Somalia, those from the Syrian crisis, and also within Kachin State in Myanmar. So we have a body of research on VYA needs. Thank you.
Thank you so much. I'm sorry for jumping over you. If anyone else is on the line who I called out, please unmute yourself. Okay. Rebecca Weir of Plan International UK. And last but not least, Marietta Wiltz of International Youth Alliance for Family Planning. Okay, at this time, if there's anyone who I did not call out, please unmute yourself and introduce yourself. Okay. Okay, this just in from Erin Portillo. She chatted, I'm here, but suppose you couldn't hear me when I unmuted. CCP has a number of youth-focused projects. I was a family planning program officer on the Health Communication Capacity Collaborative project, which just ended, under which we completed an urban adolescent SRH social and behavior change communication implementation kit, which included a focus on VYA needs. We also implemented VYA SRH research in Madagascar. I'm also the Youth Community of Practice co-lead with CCP and will be working on breakthrough action through our youth activities, though our youth activities remain to be determined. Thank you, Erin. Okay, now quickly we'll introduce ourselves in the room, starting with Rebecca.
Hi, Rebecca Lundgren from IRH. I think that's enough, so we can move on to our discussion. Happy to talk with all of you. Yeah.
Hi, everybody. This is Callie Simon with Save the Children now. I know many of you from my previous role at Pathfinder, but now I lead the ASRH team at Save the Children. And I think the work that Save has been doing on VYA has been referenced a few times now, so I'll let others go around and we'll continue to talk throughout the webinar.
Hi, this is Jen Gales from Save the Children. Also, I'll keep it brief, just to mention that one of the main VYA programs that I'm working on is Growing Up Great, which is funded under the Passages Project, which also houses now the VYA Alliance.
Hi, this is Allison Foster. I work on youth engagement and cross the passages projects here at IRH. And I previously have also worked at Advocates for Youth with advocacy around engagement with adolescents globally. And I also wanted to just add that we have had an additional person come in, Tess Jomi, who's the Senior Youth Advisor of the Office of Population and Reproductive Health at USAID.
Thanks. Hi, everyone. This is Breenon Kiernan. I work at the Institute for Reproductive Health at Georgetown, and I'm a program officer on the Passages Project, supporting the Growing Up Great program, working with Johns Hopkins School of Public Health, Global Early Adolescent Study, and Save the Children.
And I'm Sammy Hill. I'm the Communications Associate here at IRH, so I support the communications efforts of all of our projects, including the Passages Project.
Great. So thanks everyone for taking the time to share and to introduce yourselves and also to listen. I know it took a while, but it was nice to see through the depth and breadth of diverse skills and experiences on the call and on this task team. So we can move on to the next slide. Just quickly want to look at some of the activities that we've worked on as a task team this year. We've updated the distribution list of people who receive emails from us, and we are at over 150 people now. We've updated the VYA SRH resource library that's housed on K4 Health. As of October, we had about 214 resources. We sent out a VYA task team member survey in July and received 53 responses from all of you. With those results, we put together an infographic, a one-page infographic that was shared in September. And today we've held our first webinar. So I really want to thank everyone on this call for filling out registration forms, surveys, sharing resources, and I also want to thank Allison as our youth engagement intern, who has been essential in helping us follow through on all of these activities. So thank you, Allison, and now I'm going to hand it over to her to discuss the infographic we put together with the results from that survey.
Thanks, Brinan. So just a brief overview of the infographic that you all will have seen already. But most of our members of the task team work at the international NGO as well as the local and national NGO level, as well as in universities and governments. And then the subject matter that we are all really focusing on is sexual and reproductive health, health in general, gender and empowerment, and adolescence and youth. And this is showing from most to least importance from the ranking, but obviously all these subjects are very important to the members on the task team. The greatest reported program challenges to us are lack of youth-friendly services across the board and the absence of evidence and inadequate funding, and continual limited examples of successful interventions with key populations. And that really rings true to why we've created the VYA toolkit online in one central location. And what are we interested in? And 100% of people have said adolescent girls, which is a very good thing for us to be aware of. And we're very glad that we have tapped into that already in all of our endeavors. But we also were good, it was very good for us to know other key populations for us to know, and these circles relate to the size of people's interest in the survey. So 79% of people want to talk about effective programs, followed very closely by people who want to talk about program principles and advocacy for VYA programs in general. And people could talk about what they were interested in multiple areas. I think that was very important to add here. And that was cross-cutting to people's interests. A game changer for VYA programs would be involving adolescents in the actual planning and implementation of programming, including their monitoring. And 85% of people are interested in successful VYA programs, among other resources, 72% of which of the survey participants want more successful intervention toolkits. And that really rings true to the VYA online database that we are collecting, just so that members can have actual resources that are really accessible to you all, and to the fact that we wanted to really create a task team where sharing is so helpful.
Great. So it's my turn now, yes? Yes. So this is Callie from Save the Children. I hope you all can hear me. And now is what I think is the fun part. We get to discuss what we want to do as a task team. So you'll notice that this group is called a task team, which is a very proactive sounding team. It means we got to do things. And there have been 3 goals proposed for our task team. And I'll just repeat them back to you. You saw them at the beginning of the presentation, but we've come a long way since then. So the first one is raising awareness of the importance of investing in VYAs and identify emerging best practices. The second is make program practices, tools, and guidelines widely accessible. And the third is provide opportunities for practitioners, policymakers, and researchers to reflect, document, and share learning to support effective programs. So there are 3 pretty broad goals, looking at sharing information, making programs, practices, and tools available, and creating opportunities to share learning and support effective programming. And so we need to now decide together how we want to achieve those goals. What are the concrete activities we think we can do as a task team, recognizing, as many of us do, that task teams have limitations in what they can do, but what could we do as a task team to help us achieve those goals? What would you all find to be a useful set of activities or useful endeavors that we could accomplish together that would benefit your work and your programming and the broader VYA community? So it's a time to brainstorm. And so let me just ask, if they unmute themselves, they can just share ideas, yes? Okay, so you all should be able to unmute yourselves and jump in to suggest things that you think would be useful for the task team to do. So this is a brainstorming opportunity. We're not gonna do everything everybody says, so you can go ahead and suggest something even if you don't have time to do it yourself. we're going to get creative. There's no bad ideas. And we'll open the floor and feel free to jump in. Things you think would be useful for the task team to do to advance VYA programming, learning, advocacy, and related efforts.
Hi, everyone. This is Kara Endyke-Dorn from MSH. And when I was listening to everyone talk, there's a lot of really interesting work going on in the field and around the world. So, I mean, one of the first things, maybe it's slightly obvious, but we could each volunteer to talk about our programs in more detail. Maybe during different webinars, we could each have like 15, 20 minutes to talk about our work and what we're doing and challenges we face and lessons learned, just to share experiences, especially within the group here.
Great.
Callie?
Thank you, Kara. So, yes.
This is Marjorie. It was helpful yesterday. We had a discussion actually about very young adolescents, and we talked about how the need for a broad sort of holistic, comprehensive approach that's different perhaps from older adolescents. And in looking at the list of people participating today, we do still have a strong health focus, I think, of many of the agencies. And I'm just wondering if perhaps it might be helpful to consider broadening into other sectors. I know we have some education, but maybe more on employment or social work, other areas that would diversify, covering the needs of very young adolescents.
Yeah. Thanks, Marjorie. Great suggestion. I think and for those of you who missed, Marjorie and her colleagues had a lovely brown bag, I guess you could call it, just the other day. Was that yesterday, Marjorie? On on very young adolescents and a couple other different adolescent populations. And yes, this did come up, and it was a really important discussion. So thanks. That's a good idea. Other ideas, things that you would find beneficial?
This is Nicole with Advocates for Youth. Just an idea. I know it was mentioned earlier that the task force has been doing, the work has been visible at the International Family Planning Conference. So another idea would be for the group to just organize, to do organized panels or presentations at a diversity of conferences, maybe, to really raise the focus on very young adolescents within discussions, and they're often more focused on older adolescents.
Mm-hmm.
Just to follow on that, what about a track at one of the ICFP conferences on VYA?
Mm-hmm. Anyway, yeah, we can certainly advocate for that. I know that there's a youth track at the upcoming ICFP that they're working on planning. It's maybe there's sort of a sub theme there around VYA that we can advocate for. Great suggestion, and good suggestion on. Thanks, Nicole, who also did a great job yesterday at the brown bag for the suggestion on a range of different conferences. And if folks have specific ideas, you don't have to say them out now, of upcoming conferences and events other than ICFP, which I think we've just mentioned, where a focus on VYA or a panel on VYA might be beneficial, please do share that in the chat box or now or after the call.
So this is Rebecca. There is the upcoming SBT conference in April. So one thing we could do is put out a call to this group of anyone who would like to present something there, and see if we could put together a panel or two.
Rebecca, which conference was that?
The Social Behavior Change Summit in Bali in April.
Great, thank you.
And I know it's
just as far as,
oh, sorry, please go ahead.
I was just going to say a couple other thoughts of just like if to achieve maybe just broader advocacy or gaining attention around VYAs. I think sometimes it's believed to be more a niche area, or there's only a few people working on it. Maybe it would be helpful to, as a group or as a task team, develop infographics, that type of thing. But it's not just facts and stats, but like who's doing what, like maybe even a map with call out boxes of who's doing what in which areas on which topics. I think that could be kind of interesting as something that could be more widely referenced and bring more attention to the diversity of work that's underway and how this is really a growing body of research and activities. That's one idea. And then also I just think the recommendation of conferences I think is great, but like infiltrating well beyond the routine RH and even FP conferences, especially given the learning about how important education is. I think even many of us come from a health angle, but thinking about the different communities that we need to engage and would want to engage around VYAs, I think is really helpful. And maybe even developing like a one-pager of like our messages, like or key learnings could be beneficial.
Mm-hmm. And sorry, could you tell me, that was a great suggestion. What was your name?
Oh, sorry, sorry, Jennifer Schleck from Women's Refugee Commission. Sorry.
Thank you, Jennifer. I'm sitting across the room from the computer, so can't see who's talking, but appreciate the suggestion. And I think those of us in the room here, were nodding quite a bit at your suggestions, especially the idea of kind of mapping and showing that this maybe isn't as niche of an area as everyone thinks, that a lot more people are working on it and recognizing the importance of it, which I think can compel further investment. So that's a great suggestion.
Could I jump in? I know I already gave an idea, but since it relates to advocacy, this is Marjorie. I was looking at the mission. It seems that it has a focus, but this broader thing of reaching also donors, I think because part of their priorities tend to dictate some of the programming and research. And if we could do some advocacy work that would look more at how they structure their funding, that allows VYA, things to fall through the cracks, might be another. It's a little bit broader maybe than the intentional mission right now, so I don't know if that's something to consider. Not just encouraging them to look beyond their usual priorities, but some accountability or tracking of what is being funded to see, what percentage actually might be going or not to VYAs. And another advocacy idea might be creating an image of a very young adolescent, like we have the day of the girl and we have the day of this and that. I haven't heard of a day of specifically the very young adolescent, so I don't know if there's a little bit of marketing that could be done in that sense.
Mm-hmm. Thanks, Marjorie.
This is Lorette. I was just thinking too, there's so much work being done here in the US domestically on adolescents, and there are successful models, and I think some cross fertilization with domestic would be a good idea.
Great. And Lorette, hopefully you can help us with that. Go ahead.
Sorry, Lorette.
I'll try.
This is Jill from MSH. I just want to chime in and say that these ideas are great, especially the mapping. I was also sitting here nodding when the mapping was mentioned. And I'm wondering if we could go beyond even just mapping the programs to thinking about what are the approaches? How do the activities on the map fall within technical areas, and what can we start saying about the models that are emerging? For us as an implementing organization, it would be great to see what are the different models that are being employed in different contexts, and any initial results that are coming out of that. And also, as we think about advocacy and moments to create awareness, we're talking a lot about global conferences, but there are also regional events, and we should think about how to engage with our colleagues at the regional and country level. The Ouagadougou Partnership meeting is coming up in December, just for example. It might be too soon to do something, but that could be those types of moments we should look at, and maybe even work with IBP on to identify events and link up with them.
Yeah. Thanks, Jill. That was Jill, right? Yeah, so that was a good suggestion. And I was also thinking along the same lines with the regional efforts to the global conferences reach a different audience. And I think that's a really important point, and a nice idea around the models and approaches as well. So we just have a couple, like maybe one more minute to take up exactly my 10-minute allocation for this. So I wondered if other people had any quick kind of rapid fire additional suggestions. These have been really excellent.
This is Martha Murdoch from MSH. I have one quick suggestion. I know that I3E did a sort of a research compendium of the gaps in research on adolescents. It might be interesting to identify if they have recommendations that are very specific research gaps related to this particular group. So just to add in terms of gaps.
Great idea.
And this is Gwen Morgan from MSH and the Evidence to Action Project. I know that one area that was really challenging for us when we were designing a program back in the 2000s was what is developmentally appropriate information to share with the younger group versus the older group, and what do they, what's different? Because a lot of the curricula that were available to us were for 15 to 24-year-olds. And we were trying to tailor something that was culturally appropriate and, acceptable for schools and parents. So I don't know if that's something that you guys do, but resources around child development and age-appropriate information.
Thanks, Gwen. Yeah, and I think that is something that I'm sure many of us contemplate as we're developing the various tools and curricula. There is some international guidance out there around that, which I hope is on our VYA toolkit on K4H. I will check to make sure if it is, but so you can check that out. But it is still relevant as you get into contextualizing that to every country and thinking through what is appropriate in certain contexts. So thanks for the good suggestion. So for folks who have other amazing ideas that you haven't had a chance to say, please do either chat them in the chat box. We will record them and keep them on our list, or email us with them. Can they email you, Brinan? Yeah, okay. Email Brinan. She's the one who's been emailing you with all of the invites to this meeting. So you can email her with your additional suggestions. And what we're going to do is we'll take this list and compile it, and we'll do a bit of organization of the ideas and thinking about kind of feasibility, but then we'll come back to you all for next steps on these ideas and thinking about who would like to volunteer to take on some work in these specific activities and how we would plan out our time for the next year. So keep the ideas coming via chat and email, and then we'll be coming back to you all with a kind of compiled and organized list and some suggestions for next steps for everyone to feedback on and volunteer for. Does that sound okay? Any last comments or questions on this brainstorm piece? Great, thank you so much. I'm really excited about the ideas that were generated, and I think that they'll add a lot of value to our space. So with that, I think I turn it over to Jen, yes?
Yep.
All right, Jen, take it away.
Thank you, everyone, for your great ideas during the brainstorm. I'm going to pick your brains just a little bit more and very quickly, since we only have a few minutes left, about potential topics for the next webinar. The list that you can see here on the slide are your own ideas from the survey that was sent out earlier. And I know we also heard already a couple ideas during the brainstorm about maybe some more webinar learning sessions on our own work, member work. So certainly we'll add that to our list of topics. But because we're so short on time, I guess I would just ask you, looking at this list, is there anything that jumps out at you as really important that we should prioritize for an upcoming webinar, or is there anything that you don't see on the list that is just really a burning topic that you think we should definitely have on the list?
Hello, this is Jane Otai from Japaico. And I think what I do not see on the list is we know that many countries are not prioritizing very young adolescents. How can we make very young adolescents, how can we get data for very young adolescents within the health sector so that we can know what challenges they face and be able to respond to their challenges? So data that is disaggregated so that we can be able to really learn what very young adolescents are going through and what the older adolescents are going through. I think if we could get the Ministry of Health, push the Ministry of Health to have routine data for very young adolescents, that would help. How can you advocate for that?
Yeah, that's great. Thank you, Jane. I think you're absolutely right. I know there's a number of donors and organizations who are working on that. So we'll add that.
This is Kate Gillis. I see youth engagement there, and I'm really happy to see that. I would love to, I think that's a pretty interesting topic when it comes to VYAs, because youth engagement for the very young adolescent community is going to look pretty different for youth engagement for older adolescents. So, youth engagement continues to be sort of a, how we do it well continues to be a question for for everybody working across the adolescent spectrum. But I think it's particularly interesting here. What does that mean in the context of VYAs?
Yeah, that's a great point.
Hello.
Thank you.
Hi, this is Jeannie Long from Save the Children, and I guess one thing that I don't think is lacking, but it's not, it could be in several of these points, and that I'm hearing directly from my country office colleagues is engaging with parents and acceptability of some of the topics that we want to talk about, or that we want to train teachers on, and that we want VYA to understand, and basically working with parents and communities to make those topics acceptable. Because we talk about age appropriate, information, but the truth is a lot of times parents don't think that information is age appropriate, and there's a lot of stigma or taboo about even talking about something like puberty. And in some of the countries I work in, they actually call it puberty education instead of comprehensive sexuality education, because just saying the word sex turns people off automatically. And in Uganda, there's a ban on comprehensive sexuality education resulting from angry parents. And so there's, I think that could fit into several of these areas, what works or sociological interventions, but I'd like to hear specific examples of how when we're going into a topic like sexual reproductive health for VYA, how do you get the communities on board and to be able to start talking about these things?
This is Marjorie. Another idea I don't see on here perhaps might be the legal aspects for programming for younger adolescents in terms of, parental rights versus individual rights. I'm sure this is always a blurry area for programs that want to try some new things. How far can they go? What is supported? And I know this is going to vary widely across the world, but some kind of legal framework might be interesting to hear, more on that.
Okay. Yeah, thank you so much. Unfortunately, I'm going to have to wrap up comments there, but if you have any other ideas that we weren't able to discuss, please share them with Brinan. Hopefully Brinan's going to have just a deluge of emails from all of you. But yeah, thank you so much for your active participation.
Great. Thank you, Jen, and thanks to everyone for sharing. We're going to skip over our discussion on the VYA Task Team Directory and Engaging Youth. We're hoping to move the Engaging Youth conversation to another webinar, and on that second webinar, we can also talk about the directory then. If there's any other business, now please speak. We have 1 minute. Otherwise, thank you so much to everyone for joining. We are so happy to have you all here. It's been a pleasure, and we look forward to hearing from you in the future. Okay, I think that's it. Goodbye, everyone. Thank you.
Thank you all.